With this, I'd like to invite Professor Hua Yan to give the first talk on ophthalmic trauma, the Chinese and Asia Pacific perspective, with introduction by Dr. Rupesh Agarwal.
Thank you, Professor Ganga. And it's my honor today to introduce my dear mentor, and if I can call him my friend as well, who has taught me a lot, and he never leave any opportunity to teach. And even in this conference, when he was very busy in Tianjin, he was teaching me, giving some of his skills. Before you can see Dr. Mohan Rajan and none other than Dr. Ganga standing beside him at this meeting. And we really very fondly remember this meeting in China. And this is the picture already shared by Professor Natarajan, where we have Caroline Chi and Annette Hoskin and Dr. Ganga with Professor Hua Yan. So he is the really, in sense, as we are talking about the 5 continents here. So the first continent to go, and can I have his video, please, Andres?
Sure.
Thank you. The first speaker to go today is from the Asian continent. Before it will be, the next one will be the European continent. But let's hear from our Asian continent, who is the president of Tianjin Medical University. Again, very well accomplished in the field of ophthalmic trauma, does not need any introduction. If we call Professor Ferenc Kuhn as the father of modern ophthalmic trauma management, I think Professor Hua Yan and Dr. Natarajan, they themselves have taken the ophthalmic trauma management in Asia to a different level, and he has well published numerous books on ocular trauma and numerous publications, and those are countless, and is really very much committed, and one of the rare people who is so much committed to the management and the care of ophthalmic trauma. He is the president of Chinese Ocular Trauma Society, as already shared by Dr. Ganga and Dr. Natarajan, and he's been Vice President of Asia Ophthalmic Trauma Society, Asia Pacific Ophthalmic Trauma Society from the very beginning, and been the guiding force and the mentor for a lot of us and all the residents and all the colleague ophthalmologists in China. Professor Hua Yan, your video.
Thank you so much.
Azra, Lukish, and everybody. Today I'm talking about the challenges in the primary and secondary ophthalmic trauma management in the COVID-19 area. So at the beginning of December in 2019, COVID-19 caused by 2019 novel coronavirus spread rapidly throughout the world. So at the beginning of 2020, the World Health Organization and COVID-19 was a public health emergency of national concern.
Can we increase the volume, Andreas?
Globally,
I think it's
at the end of 2020,
no.
there have been more than 18 million confirmed cases of COVID-19, and the represented is mapped by blue color in almost 1.7 million deaths represented by the all the color in this map reported by the WHO. So the epidemic of COVID-19 in China has been gradually and effectively controlled, although occasionally for radic and small class of cases. And the multiple protections of some routine diagnoses in treatment have been carried out normally. So during the period of pandemic of COVID-19, we still have the ophthalmic emergency treatment, limited time surgery, and elective surgery. So this is the challenge. The current clinical observation and epidemiological studies show that the transmission of COVID-19 is laden with respiratory droplets and contact. Also, may also be one of the roots of virus transmission. People are generally susceptible to the disease, and there is a phenomenon of aggregation. Medical staffs have a greater risk of infection with treatment persons. So for safe ophthalmic surgery and treatment, since the occurrence of COVID-19 with the activation of case treatment and in-depth research, the Chinese National Health Commission has updated the clinical and epidemiological characters of the COVID-19 time. So the latest diagnosis criterion pattern includes the cases and confirmed cases. So now I will introduce the outpatient and emergency screening, ophthalmic ward management, preoperative preparation and intraoperative protection, postoperative management and post-application, so the safe surgery and treatment during the epidemic of COVID-19 in all hospitals. So for outpatient and emergency screening, all patients and their families need to wear face masks while entering the clinical area. Before treatment, the patients are checked with COVID-19, like temperature monitoring and the epidemiological investigation. The ophthalmologist in the ophthalmic diagnosis area should complete the ophthalmic examination and the first level protection. And the patients who have been diagnosed should be treated strictly with the third protection. And patients who need surgery should be checked according to the blood routine, CRP, chest CT, nucleic acid test, and the new coronavirus antibody test. For outpatient and emergency screening, if there is any abnormality, consultation with the relative department is required and double expert consultation. So the department, like the infection department, respiratory department, and emergency medical department, will be initiated. If considered as a suspected COVID-19 patient transferred to the isolation ward, the retrovirus nucleic acid test is completed, and those who tested positive are quarantined to the designated hospital. If the virus nucleic acid test has not been completed, but urgently needs surgery, please consult with the expert in the anesthesiology department and start the operation procedure of the suspected patient and confirm the operation in the negative pressure operating and return to the isolation ward of the operation and wait for the nucleic acid test result. Medical staffs enter the medical isolation ward for isolation, waiting for the patient to move to the acid test result. For ophthalmic ward management, there are isolation wards, buffer wards, and general wards in the ophthalmic ward. The medical staffs in the ward have first level protection, and only one family member is fixed to be accompanied during the hospitalization. Patients and their family members wear face masks throughout the hospitalization period and are not allowed to go out. If they have to go out, they must register. Patients and their families complete the nucleic acid test before admission. The patients are transferred from the isolation ward to the buffer ward, transferred to the general ward after the operation period, and the staffs of the department should provide all protection and elimination of the treatment and the environment regulation. For preoperative preparation and intraoperative protection, monitor temperature changes of the patient and accompanying family members before operation. If the patient is excluded from COVID-19, make a surgery and the local anesthesia in the hospital, and perform the operation in a laminar flow patient operating room. During the operation, the patient wears a face mask, cover the mouth, and post-operative operating room is disinfected according to the requirements of epidemic protection. If general anesthesia is necessary, before the multiple disciplinary consultation, the personnel involved in the operation should strictly adopt secondary level protection and be implemented in the negative pressure operating to reduce the media exposure. Preoperative preparation and intraoperative protection for the suspected and confirmed patient of COVID-19. Emergency surgical treatment is required due to the condition, and the level is set to class 3 phase. Transfer the patient by special channel, and the operation is performed in negative pressure operating room. Strictly control the number of people entering the operating room, and all items during the operation are supplied and delivered by outdoor monitoring nurses. And the indoor personnel are not allowed to go out well. Strict 3-level protection during the operation should be performed, like medical protective N95 masks, protective clothing, double layer latex gloves, goggles, protective visors, boot covers, and shoe covers. And disposable protective operation sheet and clothing to protect leakage are required. For post-operative management, for the patient who excluded COVID-19, the patient should return to the ophthalmic ward after general anesthesia or local anesthesia. For the suspected patient, they are transferred to the isolation room after general or local anesthesia. Medical staff without exposure in the whole process of the operation can apply for exemption from medical isolation for 14 days. If there is no exposure, medical isolation will be carried out for 14 days. If there are fever or other discomfort symptoms during isolation period, they should seek medical treatment immediately. Medical staff should take off the disposable protective clothing, shoe covers, like others, and put them into the double layer medical waste bag in the contaminated area, strict and hygiene. This is the post-operative management, including the surgical instrument, operating room environment, and stressing the disinfection intensity of the operating room after the operation. For post-operative patient management, medical staff perform the operation such as applying eye drops and replacing the auxiliary materials and the first level protection standard. Closely monitor the temperature of the patient and their families, as well as other clinical symptoms. Management of the accident of the hospitalization, like this one, such as after the patient is admitted to hospital, develops suspicious symptoms such as fever, which could not be explained by this condition, and immediately starts the identification and the diagnosis process of suspected illness. Review the epidemiological questionnaire, survey, blood routine therapy, and other blood examinations are improved. And the chest CT examination should be complete. The patient is transferred to the ophthalmic isolation ward. Secondary level protection for all medical staff and double expert consultation should be conducted. And if COVID-19 is excluded, the patient continues ophthalmic treatment, and if it is suspicious, make nucleic acid test and the specific IgM and IgG antibody again, and transfer them to the isolation ward according to the special transfer. If the results are positive, they should be coordinated with the designated hospital treatment. If the result is negative, come back to the ophthalmic single room for the observation. Thank you so much for all of you. Thank you so much for all my friends. This is my soccer game with all the ophthalmologists global pandemic and COVID-19. And with the animating of Chinese ophthalmology society. Thank you so much.
Thank you, Professor Hua Yan. That is just fantastic. I think you have shown us not just the challenges, but how to really overcome and manage these patients optimally during this challenging period. And we have a lot to learn from you. One of the continents which is really affected right after Wuhan was affected was Europe and Italy, for example. And we still seem to be suffering from COVID crisis with resurgence in the European continent and especially the UK variant.